Hey everyone, welcome back to Ask Dr. Slater. In this series, you get to ask me, a board-certified orthopedic specialist with 17 years experience in this field, your healthcare questions. So if you found this helpful, make sure to like and subscribe so you can submit your own questions that we'll be answering each week. Let's get to it. Don't get talked into surgery for your carpal tunnel, at least not before you've properly tried to treat your neck. I could very easily save you from unnecessary carpal tunnel surgery. You can see my TikTok or YouTube page that has a free carpal tunnel series, or if you want to do a little bit more in depth, the spinaltruth.com, there's a neck course that will take you through treatment. It's $99 that might prevent you from surgery. This person writes, they almost talked me into surgery for this. I knew it was coming from my neck. Most of the time, your carpal tunnel is actually coming from your neck. It's a nerve issue at your neck, not a nerve issue at your wrist. And at the very least, this should be assessed and even attempted to be treated before you have unnecessary surgery that can't be undone. All right, if you have tinnitus, what? If you have tinnitus, listen to this. This person writes, oh my God, it instantly went away, thank you. So I talk about how your spine, muscles around your spine, the joints of your spine, specifically around your neck and upper back, can cause changes into your ear, pain, ringing. And if you address these issues, the ringing or pain will go away and go away relatively quickly. And a lot of times in the differential diagnosis of ear symptoms, you're not getting this treatment or this thought process. And I just want to bring it out there to people that your neck, the musculature, the joints can cause changes into the ear, face, eye, jaw. And if this is the case and you treat this area properly, you'll see significant changes in a short period of time. What about cubital tunnel? So could it be cubital tunnel syndrome? So cubital tunnel syndrome is an irritation of the ulnar nerve, your funny bone, the ulnar nerve at the anatomical site of the cubital tunnel. Typically, if this is the case, the symptoms will only be here or down into your hand. They won't be higher up. They will also not be bilateral. So if you're having symptoms into your pinky and ring finger on both sides, it's almost always your neck, your lower neck that's causing the issue, not your elbow. And a lot of times people will get told that it's their elbow and they need to have a surgical release of this area to move the nerve or take pressure off the nerve. And they'll get that and it'll help temporarily, just like carpal tunnel surgery will help temporarily, but your symptoms will still be there and or return because they didn't get the underlying cause, which was higher up. So before you get these surgeries, before you get these diagnoses and these treatments that aren't working, think or try at the very least working up a little bit higher in the neck where the nerve is actually starting and coming from before you go down the rabbit hole of unnecessary surgeries and other procedures. If you have tarsal tunnel, you probably don't have tarsal tunnel. Hold on real quick. So this person writes, and I'm not quite sure what they're saying, but nowhere on your site does it say you work with people with tarsal tunnel on both feet, flat feet, and plantar fasciitis. No, you don't. You do not have bilateral tarsal tunnel, bilateral flat feet, and bilateral plantar fasciitis. You have a nerve problem coming from your back, and that's causing all of these symptoms down into your leg. Remember, I talk about on my channel a lot, there's 5 symptoms that typically mean a nerve issue rather than a local issue. If it's symptoms on both sides, if it's alternating, if there's numbness and tingling, if there's symptoms at rest, all of these mean a nerve issue, more likely a spine nerve issue, rather than a local joint issue at the fascia or tendon or muscle or something like that, okay? So if you have tarsal tunnel and you've been getting treatment and it's not working, start to think that it's not actually impingement of the nerve at the tarsal tunnel. It's actually coming from higher up where the nerve starts, and that's why treatment at your ankle, at your foot, isn't getting your symptoms better. That's it for this week of Ask Dr. Slater. Make sure to leave your questions in the comments. Make sure to hit like and subscribe so you don't miss this series. Stay tuned next week.